Everyone, this is Kim Davis Allen. Thank you for joining today's webinar. We're getting set up still and letting people have a time to sign on, so we'll get started in just a few minutes. Hey everyone, if you're just signing on, we're letting everyone get just a few more minutes to sign on and then we'll get started. While we're waiting, today's webinar is being recorded. It will be available for playback later. If you do have questions or would like to make comments about today's topic, please feel free to either raise your hand, be sure that you have entered your audio PIN, or you can type your questions into the question and answer pane, and we'll be taking questions at the end of today's webinar. All right, just a minute more and we're going to get started. Great. Okay, so we did have a little technical difficulty getting the slides from point A to point B, but I think we got it worked out. We do have a copy of today's slides also available. If you would like those, we can send them out after today's webinar. But I think we've got the majority of our registrants started, so I'm going to go ahead and get started with today's presentation. As I said, it is going to be recorded. It is part of our National HIT Week focus on various health information technology initiatives. When you talk about health IT and the sharing of patient information, we always have concerns about privacy and security. So we thought it would be important that part of this week that we address that. We just kind of put it out there and talk about some of the things that are going on. Again, I am Kim Davis Allen. I am the Outreach Coordinator for the EHR Incentive Program, but I'm real pleased to be able to be joined today by Tatiana Melnick. Tatiana is an attorney in private practice, concentrating her practice on IT in general. I'm so used to saying health IT, but IT in general, data privacy and security, healthcare, and regulatory compliance. She represents healthcare providers, provider groups, and ancillaries, as well as software developers, data centers, and others along the technology continuum. Tatiana has spoken on our behalf before. I think you'll find her comments very entertaining and very enlightening. We really appreciate her joining us today. She holds a Juris Doctorate from the University of Michigan Law School and a Bachelor's of Science in Information Systems and a Bachelor's of Business Administration in International Business, both from the University of North Florida. Tatiana is joining us from Tampa, Florida. Thanks, Tatiana.
Thanks for having me. Thanks, everybody, for joining us as well.
Yeah. So let's kind of get started. I just have a couple of general things that we want to talk about, and then Tatiana's really going to get into more of the specifics since this is really her realm of concern. So Dana is going to advance our slides. So Dana, let's get it started. So when we talk about health information technology, like I said earlier, privacy, security, concerns about that always come up, not only from the provider's level of who is actually sharing the patient information, but definitely from the patient's perspective as well. And we live in a world of data breaches. I mean, every day you're listening to more and more. I think Equifax was the most recent one. So we have data breaches not just in the realm of health information technology. Data breaches, we think about it in banking, sharing of credit card information, health information. So when you overlay all of that type of information with health information, it just kind of raises it to a new level of concern. Next slide. I always find it really interesting, the statistics. Since we don't do this on a day-to-day basis, we're really more affected just by the headlines, the Equifax. We remember years ago, this actually came up in one of our previous workshops, how with the VTech toys, they were actually spying on the children. But these are some data breach statistics kind of worth knowing. Since the Target breach, and I think we all remember the Target breach, there has been a major data breach discovered almost every single month. And what we typically hear is that the data breach occurred when we find out about it, when it comes on the news or is in the paper. When we find out about it, it has actually occurred months before. So it's not like something that happened yesterday and we're just finding out about it today. But every single month, there is at least one, probably many, major data breaches. A recent survey estimates that 47% of all Americans, adults, have been affected by data breaches, with an estimated 432 online accounts being affected. That's significant. That's almost one in every two. According to a 2017 report, it cost an average of $380 per record to remediate a healthcare data breach. And we hear stories all the time about identities being stolen, credit card information being stolen, getting all of that worked out, because again, many times you don't know that that information has been affected until later on, until you try to go buy a house or, get some financing for something, or even really just checking your credit score in general. The retail industry was the number one target. Verizon, don't forget Verizon. Verizon had a major data breach not long ago. And then cybercrime overall has cost the global economy $575 billion. That's a lot of money. For the U.S. alone, $100 billion. And a lot of these statistics were even before you now have the new, what do you call it, like the WannaCry, that software, the ransomware. So you see a lot more of that type of stuff now. Next slide. These are just the 10 largest health data breaches in 2016. Banner Health, Anthem. I don't think Anthem's on here, but that was something that was big in the Florida area. Newkirk, 21st Century Oncology. And these are the big ones. These are the ones where people either hacked into the system or you had unauthorized disclosure or access of information. And what I hope Tatiana will talk a little bit about is not even the big ones that are just as important, it's the small ones too. It's that employee who leaves their computer up, or a laptop gets stolen, or a jump drive gets misplaced. Another thing that providers really have to think about is when you have a BYOD device. Phones get stolen every single day. So data breaches are everywhere, not just within the credit card companies, not just within the banking industry, but also the healthcare industry as well. Next slide. So here's some good statistics as well. Again, it always surprises me how, rapid this is, and how much it permeates just almost every single aspect of our lives. And I am kind of intermixing banking and financial breaches as well as healthcare breaches. But so here we go. 90% of businesses acknowledge at least one security event in the last year. And that's what they have to acknowledge. Now, when you look at the HIPAA fines and you look at the possible punishment for a lot of these things, this probably is greatly understated. As I just mentioned, we live in a big world of bring your own device. Everybody only wants to have to carry around one cell phone. There's lots of security concerns. There's lots of issues surrounding when you have a BYOD, and it's a real balancing act between convenience and protecting patients' information. 112 smartphones are lost or stolen every minute. Every minute. That's that mom who just leaves their cell phone in the grocery store the grocery store cart, or lays it on top of the car, or, the kid at the sporting event who has it next to him, and next thing you know, it's gone. 112 smartphones every minute. Don't forget lost or stolen laptops, flash drives. And then you have those people who are actually out there looking, the malicious insiders, criminal and government-sponsored hackers. Heard a lot about that with the last presidential election. The issue is not if, but when and how often a data breach is going to occur. And we think this is a very important topic, not just from a perspective of, hey, it's National Health IT Week, we're promoting the sharing of patient information. We got to think about those concerns as well, but we also need to think about it in terms of just on a personal level. I have credit cards, I have smartphones. What can I do even as an individual basis to protect my patient information and my financial information as well. Next slide. So here's how they do it. I thought this was a very interesting slide because a lot of times people say, well, why is there such a market for things like that? So there's various levels. So you have like the kits. These are the things that are like a verified health insurance. So your insurance card, an insurance claim. It could be something that is easy as a EOB, explanation of benefits that you get in the mail. Things like your Social Security number. All of this can be used to make counterfeit physical documents. This can be anywhere from $1,200 to $1,300. So, protect that information, protect your insurance card. We're always told protect your Social Security number, but, look at all these other things as well that people can use to steal your identity. The fulls are those records if they also include health insurance credentials for a U.S. victim. They're negotiated for about $500. So again, these are things that people have identified as actual events. Health insurance credentials are $20 each. So maybe you don't have all the other things. Maybe you don't have a Social Security number or a driver's license number, but you have other things. You have a policy number. You have coverage identifiers for both, the individual and the spouse and the family. So it's a high market. There's a lot of money being made off of the stolen identities, the stolen health information, the stolen credentials. So it could be the person that takes your smartphone. They don't do anything with it. They just pass it on to someone else. And there's definitely a market for that. Next slide. Oh, I think we went the wrong way. Unless I have the same slide twice. There we go. So here's some other fees for additional stolen credentials. You get a credit card, $1 to $2. You hear a lot about, we still get credit card offers in the mail. Sometimes I'll get 2 and 3. We have a bunch of kids. So, I try to shred them, burn them, whatever, but that kind of information can really be set on the black market. Scammers. There was a big thing in my hometown where scammers were found in a lot of the gas pumps. You put your credit card information in, you go about your business, pay for your gas, leave, but that information has been collected. A big market for that type of thing. You have some prestige credit cards. Personally, I don't. Those even go for more money. A compromised computer. Those are ones that are not password protected. Maybe they aren't encrypted. Maybe they have even if they're have a password, maybe it's something that's really easy to get into. That's going to $100. PayPal, verified balance, $20 to $200. And these are just some of the things to kind of give you an idea of there is such a market for this kind of material, and that's why people do it. They're very clever in how they do it. They're very sneaky in how they do it. But then you also have to think about those people who a lot of time information, especially health information, is just inadvertently left out. That lost cell phone, that computer being left up, that jump drive that's misplaced that you don't really think anything about that may have patient information on there. Next slide.
Kim, before you move on to the next slide, just wanted to mention, so some of you may be wondering, well, how does this information actually sold? If you think of eBay, and if you've ever shopped on eBay, so there are numerous websites like that on the dark web where you go on there, just like you would go on eBay and buy, a stroller or shoes or whatever. They go on and they see descriptions for all of these stolen credit card information, stolen healthcare credentials, and they just sell them the same way that you would buy something from eBay, except they're typically using Bitcoin for payment to try and maintain anonymity. So there are, and again, it's on the dark web, right? There are numerous places like that. You do have the government, the FBI, monitoring those websites, and sometimes you may be in the unfortunate position of getting that knock on the door from a federal agent saying, hey, you've had a data breach. We found your information. We found your patient information on one of these websites. And so that's sometimes how we've had a couple of clients that have been notified of a data breach from an agent because they were monitoring these sites and found the information.
That's a very good point, because you hear that term, the dark web, but I don't think people really understand how that works, and that it's really a real thing out there. I'm often afraid that I'm going to click the wrong button and end up on the dark web, but I think it may be a little bit harder to get to that. So, Tatiana, won't you do take over and talk a little bit more about the experiences that you've had? And the slide we have up talks about from a Office of Civil Rights and the HIPAA fines, but I'm sure you have a lot of good examples of how these things happen and what's happened as a result of breaches.
Yeah, there's been a lot going on. If we can go ahead, so this is just a basic summary slide talking about what we've seen reported to the Office of Civil Rights, which is the primary federal regulator of HIPAA. And so here in Florida, we also have the Florida Information Protection Act, which is a little bit different from HIPAA, and it requires you to give notice to the state attorney general. So I do want to bring that up because some folks don't realize that you do have, as a Florida healthcare provider, or a business associate, you do have dual obligations. You have to, in the event of a data breach, you have to notify the Office for Civil Rights as well as the State Attorney General. If we can go ahead and go to the next slide. So I've included a sampling of some of the OCR settlements and fines, just to give you some idea of the kind of things that are piquing the interest of the federal regulators. Now, this is a very small sample. If I have now, I'm up to a separate slide for settlements from 2016 and settlements from 2017. There have been that many that we've had. So the OCR started entering into settlements and finding folks after the passage of the Omnibus Rule back in 2009. So the first one you see is Signet Health. That was actually the first action taken under the Omnibus Rule, under the HITECH Act, and that was in fact a fine. And in that case, that involved 43 patients who could not get access to their healthcare information. So for whatever reason, Signet did not want to turn over the patient records to these particular patients. And so OCR stepped in and said, hey, we want copies of these records. And Signet thought, oh, well, if we don't answer, they'll just go away. No, that's not what happens. It just makes the regulators angry. So the fine for not providing patients with access to their information was $1.3 million, and $3 million was for ignoring the regulators. So keep in mind that if you do have someone show up at your door, you do need to address the issue one way or another, even if it's to say, please wait while we call our attorney to get over here. And it's a good reminder that you do have to provide access to patients to their information. I've seen this come up, unfortunately, more recently, particularly as we have more providers moving to a cloud-based EHR system where there may be a payment dispute between the EHR vendor and the provider. The provider and the vendor shuts down access to the EHR. You do need to think about those things because you, as the covered entity, are in the end responsible for complying with HIPAA obligations. And so you need to make sure that you've thought through, if I'm moving to a cloud-based system, right, or there's a disaster, what do I do if a patient needs access to their information? Okay, but this just gives you some idea of, again, the types of things that have piqued the interest of regulators. You'll see a number of things, a number of the settlements involved security issues using unpatched and unsupported software, using document sharing software that was storing information with a cloud-based vendor that was not compliant with the HIPAA requirements. One that I want to point out in particular is the complete PT pool and land physical therapy settlement for $25,000 from early last year, which involved the provider posting patient testimonials without patient authorization. It's perfectly fine for you to post patient testimonials on your website, but you need to have that patient's consent. To date, that $25,000 settlement is the smallest one we've seen to date. So if you're thinking, oh, my practice is very small, the regulators would just default to that minimum $5,000. No, $25,000 is the smallest we've seen. That was I believe, one practice office. And so if you're thinking of how much could this possibly cost me, if there's a data breach issue, your base amount should really be that $25,000. Okay. We've also seen some of the larger ones have been, the largest we've seen to date was that one with Memorial Healthcare System from February of this year for $5.5 million. And that involved improper employee access, where the hospital system didn't have appropriate audit controls in place. So think through in your own environment, how do you know who accessed what information? Do you have appropriate controls in place to make sure that you're monitoring what your employees are actually accessing? The last one I wanted to mention here was the one with Triple S Management Corp for $3.5 million, which was a settlement, and that was from November 2015. And I want to mention this one in particular because that system was also fined by the Puerto Rico insurance regulator. So don't forget, as I mentioned at the beginning, that you've got dual obligations. Just because your primary regulator is OCR doesn't mean that you're out of reach of other organizations. So for example, one of the things that HITECH did was grant enforcement authority to state attorneys general. A lot of the healthcare providers in Florida treat snowbirds. So you may have folks who flew in from Michigan, from New York, from wherever, from Massachusetts, to spend the winter down here in Florida, but they're actual residents of these other states. When you have a data breach, the notification obligations follow the residency of that particular patient. So if they told you that they're a resident of Massachusetts, now you also have to comply with the Massachusetts data breach notification requirements. And Massachusetts, the state attorney general, is actually quite active in enforcement. And some of the things they go after are when companies lose backup tapes with PHI on them. So you want to think through, again, who are you storing records for? Where are they stored? Who has access to them? And what are your potential liabilities? And make sure that when you're contracting with your vendors, you've really thought through that so that you're flowing down appropriate responsibility. Because if it's your vendor that's at fault, you don't want to be the one paying that $3.5 million. Next slide. And Kim, I'll turn this back over to you to talk through some of these items.
So just as Tatiana was talking about, you really just need to think through things. And we have a few slides in a minute that really kind of relate it all back to health IT. But, when we talk to people about what do we talk in terms of meaningful use, in terms of the EHR incentive program, we have to do a security risk assessment. What does that mean? What does that include? What is that whole purpose of that? Well, it all relates back to the HIPAA security rule. It's nothing specific for meaningful use in terms of having to keep patient data safe and secure and that type of thing. But it all really does relate back to what she was saying is think through the process. That was an interesting fact. I didn't know about the Michigan example. So not only do you have to comply with what you have to do for the state of Florida, if you're a Florida provider, you also have to comply with what the patient's resident state, something that a lot of people probably do not know. One of the things that we have found is that there's not a good central source of information about HIPAA a lot of times in these different rules, unless Tatiana knows of one that we can kind of relate providers back to. But this is just a slide to kind of talk about, is your business ready? This one is not necessarily specific to health IT and healthcare providers, but these are things just to know that, some interesting facts. 31% of all cyber attacks occur at companies with fewer than 250 employees. Going back to that thought that she was talking about, hey, I'm just a small practice. These things really don't apply to me. If anything happens, it'll just cost me $5,000. Apparently not. Apparently there's a wide range of fines that could be implemented. 60% of small businesses would shut down after a cyber attack. Ransomware. We're beginning to see more and more of that ransomware. And a lot of times the ransom that you have to pay is not really significant, but depending on your overall financial structure, depending on how many times you may be hit, that could be very devastating to your business. Average cost post-breach is $188 per record. That's post-breach. We already talked about the $380 to remediate a breach. 41% of small business owners have no secure data protocols. Looking back at the chart that Tatiana talked about, a lot of those fines are based on just not having systems in place, not having an audit plan, having uncontrolled access to information. So the purpose of this slide is just to kind of let you know that it's just not big companies, it's not big insurance, it's just not big financial institutions. It's anybody and everybody, especially with healthcare, that touches a patient. And most of our providers are these small healthcare providers. Next slide. Here's just kind of a more realistic picture. There's lots of good information on the internet and different information from Tatiana supplied some of this in different presentations. But this just shows the number of security incidents that have been detected. Now, it's been detected. A lot of this stuff goes on that no one ever really finds out about, but you can see it's grown 66%. It was 42 million in 2015. So it's out there. The thing is, just like with everything else, we don't want it to be a stumbling block. We definitely don't want it to be a wall to actually sharing patient information and being able to take full advantage of all of the advances of health information technology. But it's also important that you're aware of it and that you have the necessary people, places, protocols, everything in place in order to be able to manage it, just like a lot of things that you have to manage when providing patient care. Next slide. So kind of relating it back just to health IT. Again, data breaches are everywhere, but let's not really focus on what you need to do when you're providing health care and you're participating in health information technology initiatives. Next slide. Okay, so Tatiana, I'm going to let you talk about this. This is your area of expertise.
Thank you. So when we talk about HIPAA, we're really typically talking about what we generally, at least on the lawyer side here, we call the HIPAA rules. And that's your security rule, your privacy rule, the enforcement rule, and the breach notification rule. Okay, so the security rule is the one that talks about specifically to what kind of controls you need to have in place that for you to comply with the HIPAA requirements. The privacy rule, I think most of you are more familiar with because that's what governs the notice of privacy practices, that requirement to give access to patient information, and so forth. And the breach notification rule is what spells out when you do an investigation, when an incident is actually a breach. So one thing I want to caution about the breach notification rule and just how you address compliance and data security related issues in your environment, in general, you never, ever, ever want to say, there's been a breach, there's been a breach, there's been a breach, because breach is a legally defined term. And so you may be inadvertently creating exposure for the organization because you're identifying a security incident as a breach and before it's actually been determined that that in fact was a breach. So for example, ransomware. Some forms of ransomware merely encrypt your data. They don't exfiltrate. They don't do anything with it. They basically just encrypt it. One of the most recent versions that was released not only encrypted the data, but was specifically designed to destroy the data. So under the definition of breach, right, you could argue that that's not actual access or it's not a disclosure because no one got access to the information. But in order for you to make that assessment, you would have to hire a forensic analyst really to go in and assess what the iteration of ransomware it was. I'm not suggesting that it's not a reportable incident. It may be. You just don't want to say, hey, it's a breach just because you have a ransomware infection. You have a security incident until someone in authority has been able to determine that in fact it was a breach. And in part, that's because your clock really starts running once you know that it's a breach. While you're in that investigation phase, depending on the circumstances, you may have some additional room before you have to give notice to a regulator. Because again, if you don't know what to give notice of, because you haven't done the investigation, it's hard to sort of to do that. So we've seen a number of cases where one of the reasons or one of the claims by the plaintiff's counsel or an action brought by a regulator, where one of the arguments they make is you waited too long to give notice, because they have all of these internal emails that say, we had a breach, we had a breach, we had a breach, before the organization actually knew that there was a breach. So just one compliance fact that I wanted to mention. Finally, on the enforcement rule side, that's basically what does the OCR do when everything's really gone wrong. If they're taking an action against you, that's it, that's the process for them to notify you, for you to respond, and so forth. Next slide, please. So I'm going to talk specifically about the HIPAA security rule, since we are talking about healthcare IT privacy and security here. And so the security rule flows down to you and your vendors. So any one of your vendors that have access to protect health information, just like you, they're also required to comply with the HIPAA security rule. And it addresses, the security rule basically covers anything and anytime anybody accesses PHI. So whether or not they actually store it on site at their own location or merely use it to provide, on site at your location, they're still responsible for maintaining security. Next slide, please. Next slide, please. Okay. The security rule has a couple of different components. It has the administrative safeguards, which talk about policies and procedures, physical safeguards, which, as it suggests, is the physical things in your environment, like are you locking doors? Organizational standards talk about how you actually contract with other entities, and then policies and procedures. And policies and procedures tend to be the biggest factor. So as in any other part of healthcare, if you didn't document it, you didn't do it. Security in the healthcare space is viewed the exact same way. If you don't have policies and procedures governing what you did, the assumption is that you never actually did it. So if you do ever get a request for information from OCR, say you do have to report an incident, you will get a letter that requests, like, I think the last version I saw had like 24 items on it. So what they'll do is they'll request policies and procedures. They'll say, the letter says, show us records. And if anyone wants to see a copy of that, please, you're welcome to reach out to me and I can provide a copy to Kim so she can share that with the group. But so what they want to see is your policies and procedures in your records showing your compliance. So it's very important that if you are having, monthly meetings with your staff to give them privacy and security education, that you note that somewhere, that it's on your meeting agenda and you save that agenda for your compliance record. Next slide, please. So these are just a couple of excerpts showing what kind of items fall where in the administrative, physical, technical framework. And as I mentioned, the organizational piece is the business associate stuff. So you've got a number of components, and again, they all require documentation. Now, it's important to realize that under the HIPAA security rule, there are items that are noted as being required and others that are addressable. Addressable doesn't mean that you can ignore it. You are required to address all of the items, whether they're labeled as required or addressable. The difference is for addressable, you can accommodate, you can assess it and figure out whether or not that particular factor or that particular control is applicable to your environment. But it requires that you actually review it, analyze it, and figure out the best way to comply to the extent you can't do something. Okay, so it doesn't mean you can just ignore it. You still have to do something with it. So at the very least, you have to document it in your policies and procedures to say, hey, this procedure or encryption doesn't work for us for XYZ reasons, right? Or in our data backup plan, we can't do X because whatever isn't feasible for us, okay? So we just had a significant hurricane come through Florida. You all should have had an opportunity to test your disaster recovery plan, at least a little bit, or at least figure out that, hey, we've got some issues that now we need to improve. This is the perfect opportunity for you all to go back to your disaster recovery plan, review it, and update it as necessary, and put that stuff in your records to show your compliance. Next slide, please. And so Kim briefly talked about meaningful use and the requirements under the meaningful use reporting obligations for undertaking a security risk analysis. It's, I guess, one thing I want to know about the SRA process. A lot of providers have relied on their EHR vendor to provide attestation for the security risk analysis component. So they've been unfortunately under, the unfortunate misconception that the only piece that applies to is the EHR, and they've ignored the rest of their environment when looking at the security risk analysis. Next slide, please. So you've got, and I wanted to go to here specifically because when you upload your SRA, someone is reviewing that on the government side. And we've seen a number of SRAs be rejected as being incomplete or inadequate because they did not look at the entire environment in the organization. So you have to look at, what about your billing system? Is it just your medical record system or your billing system as well? What about the BYOD issue? What about security and training and awareness issues? Those things need to be addressed in your SRA, and so to the extent they weren't properly addressed, you may end up getting your report kicked back saying, hey, this isn't adequate, and that may unfortunately trigger it may trigger a more comprehensive audit. Next slide, please. And Kim, I'll defer to you to talk about the asset inventory.
Yeah, and this is kind of like, I was going to ask you to, this is probably, when I talk about, in terms of meaningful use, let's just kind of boil it down to meaningful use. The requirement is that you do the security risk assessment. But there's not a checklist that says, hey, this is everything that has to be in it. The one thing it does talk about is that you do have to have an asset inventory. So going back to even what Tatiana said at the very beginning, when you look at that asset inventory, when you think about this whole security risk assessment, it is looking at your organization or your environment as a whole. It's not looking at just what the billing system does. It's not looking at just what the front desk person does. It's looking at every single thing in that office that touches patient information. I think on one of your slides earlier, you had the copy machine incident. That got a lot of national news where a health company had a rented copy machine that CBS News got a hold of. Well, it still had patient information stored in it because that's what copy machines do. So think about your copy machines. Think about your bring your own device. Think about your billing company. Think about your check-in system. I know several times that I've gone to the doctor lately, I check in on an iPad, You got to think about everything in there. So it's anything that processes, transmits, stores, any type of EPHI should be included. And I'm really going to Tatiana went into more of the specifics of the HIPAA rule because, again, it just talks about you have to comply with that. It doesn't really go into a lot of details as to every single thing that really is encompassed in that. Now, like she said, when you do your meaningful use application, we are asking that you upload a copy of that security risk assessment. We look over it, and we try to make sure this is comprehensive as possible. And if we see things that are just kind of like, maybe they're not, maybe it doesn't have an asset inventory, maybe it doesn't have like a final report, we will send it back to you and ask you for some additional information. There's also a post-payment audit perspective. It may pass kind of what we look at. They may look at it a little more further and ask for some more information. But I think the whole bottom line of all of this is more than just complying with that first measure of meaningful use. It's really also making sure that you've thought through the bigger ramifications of the HIPAA requirements. This is just kind of an end result, and it kind of forces a lot of providers who may have never thought about, I need to think about having two-factor authentication. I need to really limit who has information, who has access to information in my medical record. I need to have a disaster recovery plan, and we totally understand smaller practices. I'm small, it's just me, a couple of nurses. I don't need to think about these things, but the bottom line is that you do. So I think the asset inventory is a really good way to start that process. Because it does force providers to really look at everything that kind of comes in and goes out of their office as touching PHI. The other just qualification on the asset inventory in terms of meaningful use, the meaningful use application, is that we're not looking for a detailed list. No, we don't need to know that you have a 2017 Dell desktop, blah, 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 blah. We just need to know you have 5 desktop computers, 4 iPads, 6 bring your own devices, things along those lines. So we get a lot of questions about the security risk assessment, but I hope providers will kind of step back and think that, hey, this is kind of like the first step, or maybe even in the end step of making sure that you've addressed all of this in the bigger picture of things. All right, next slide.
So as you're, go back one more. There we go. So as you're thinking of, okay, so Kim and I just talked a lot about all kinds of different requirements, and unfortunately, compliance is expensive. So when you're thinking of through, okay, well, how do I best use my limited resources? That is, how do I get the biggest bang for my buck? You may recall that at the beginning of the presentation, Kim said that the cost for remediation, the per record cost for remediating a healthcare breach is $380 per record. There's a number of factors that go into that cost and into increasing that cost or decreasing that cost. And that data is from the most recent report from the Ponemon Institute. They put out a data breach report every year. They've been doing it for about 10 years or so now. And so those are the cost numbers from the 2016 year, okay? So when they're talking through with these organizations and they're saying, okay, well, what added to that cost and what subtracted from that cost, right? So if you're thinking of what do I do internally at my organization to try and lower the cost, the first thing you can do is actually have an incident response team, right? And the reason that this decreases the remediation cost is because you already know who to go to if there's a problem, right? So you're not delaying notification, you're not delaying the investigation, and thereby making the problem potentially worse because you're not closing down loopholes. You already know who to go to. You already know who you need to call to give that notification and to get that ball rolling. The next item is extensive use of encryption. While encryption is great and you can, in a lot of cases, it's free. You just have to enable it. So for example, all of the new Windows machines come with BitLocker. It's free, but you have to turn it on. And just by you turning on the encryption in that, so if that machine is stolen, you've already got yourself covered, right? So now instead of having to worry and try and reconstruct what was on that machine, you're going to know, hey, that machine was encrypted. No one's going to be able to get into it. Okay, so again, boom, another factor for you that you're not extending a lot of cost on other than calling your IT person to come in and enable those encryption features. Employee training, right? Again, another thing that is going to lower that cost of remediation for you because your team is going to know, hey, this is an incident, we need to report it, or hey, this isn't something we should do, or hey, I shouldn't email that, or I shouldn't open that email and type in my login credentials because I know that is it's a scam email because I've seen those through all my training. Now, on the other hand, what kind of things increase remediation costs, meaning it's going to add to that bottom line, that $380 figure? Well, third-party involvement. So all of, unfortunately in healthcare, right, we can't run the show by ourselves. You have to work with third-party vendors, whether it's your billing company or your IT vendor or your EHR vendor. We're all working with third-party companies to help us provide services to patients. And so having those third parties involved is automatically going to add to your bottom line because, again, there's more cooks in the kitchen, okay? Having extensive cloud migration, so having a lot of your information in the cloud does unfortunately increase your remediation costs because depending on how that deployment is architected, there may be some additional risks. So it is something you want to assess for your own organization and make sure that your contracts, again, are properly assigning liability. Insurance protection also adds to decreasing your remediation cost. But I want to caution that if you're going to buy data breach insurance, please make sure that someone actually reads that insurance policy. So in some of the data breach insurance policies I've seen, for example, they will not provide coverage for data stored in the cloud. So if you are using an EHR system that stores data in the cloud, well, that insurance policy is not going to be very helpful to you. I've seen other policies that don't cover independent contractors. Well, if you're a practice that uses a lot of independent contractors for your providers, that's going to be an issue for you. And so you really want to make sure that someone's actually looked at that policy and made sure that it actually aligns with the way you run your business. Because there's no reason, at least in my view, to pay for insurance if you can't use it. So just a brief summary of what you should be doing, I think, as you're looking at, okay, if I need a checklist of what to do going forward, plan ahead, right? Think through your organization, think who should be on that team, and develop an incident response checklist. Because at least then you'll know the steps to follow, and you're not going to be, running around with your hair on fire when there's an incident. Encrypt everything you can. Anything that has data on it, encrypt it if you can. Train your staff. To me, I think a low-cost option for training staff is forwarding on or using the OCR notices during your monthly meetings, forwarding them on to your staff. So if OCR has a monthly newsletter, basically, that they send out that talks about security and includes reminders. Perfect opportunity, right? Low cost for you, and it's a way for you to supplement your compliance program. I already talked about buying insurance. Just make sure you understand what's in it. And then data loss prevention, putting in controls to avoid inadvertent disclosure of data. So if you're in the Office 365 environment, for example, there are policies that are already within that system that you just need to enable in order to control how data is shared outside your organization. Next slide. And Kim, I think this is for you. All right, well, I think Kim may have dropped off inadvertently, or Kim, maybe you're on mute.
Sorry about that. I couldn't get back to my unmute button. So the training the staff, I just want to kind of follow up on that. That is something that we see a lot of times with providers. When we're talking to them, it's like, oh, we don't really have any kind of formal training program. And it sounds like even a little bit of training can go a long way in helping employees understand about data incidents. I'm not going to call them breaches anymore. I'm going to call them incidents until they're determined to be a breach.
Absolutely.
Just quickly.
Go ahead, Kim.
No, you go on, because they'd much rather hear from you.
So I think, I know you all have team meetings in your organizations. There is, you can include like a one-page handout, right? Show examples. So if one of the things you want to train your people on is, what does a spoofed email look like? What does a fake Facebook invitation look like? What does a fake website look like when it's asking for credentials? Show them examples, right? And save that for your file, save that for your records, because even a little bit of knowledge is going to help decrease issues, or at the very least, make your employee aware that, hey, they need to give you notice that something went wrong so that you guys can investigate, right? Everybody makes mistakes. It's only human. OCR does not fine everybody that submits a report. It's understandable that you may inadvertently fax information to the wrong number. It happens. We all make mistakes. But the test is really, did you train your team, and did you put in appropriate controls? And now that you've had an incident, how do you, are there any improvements that you can make? So you really, again, want to train your team on, making sure they're giving you prompt notice that you can take appropriate steps to remediate if needed.
The example about the fax number, we actually have an employee whose father's business was one number off, fax number was one number off than the local OB's office. So needless to say, he would continually get faxes that were really not pertinent to his business. They were more definitely applicable to the OBGYN's office. So, yeah, mistakes happen. People are human. Quickly, just to let you know, also in terms of meaningful use, there is a requirement for health information exchange. This is that sharing of patient information. This is most providers use secure email services. The requirement is that you have to create a summary of care record for those patients that you are transferring to another provider of care, and you have to electronically send that summary of care record for more than 10% of those transitions and referrals. So there is a service offered through the Florida Health Information Exchange, next slide, called Direct Secure Messaging. It is a web-based, secure, HIPAA-compliant email service that allows you to be able to not just share patient information if you don't already have a mechanism to be able to do that, but it also helps you meet that meaningful use measures. As we look ahead in terms of meaningful use in stage 3, there's more and more requirements to actually share patient information. So we just want to let you know that there is a pretty low-cost alternative. It's very competitively priced based on other search services in the market. Probably the best feature of the service that we offer is that, let's say that you have the secure email service, but you need to notify a patient, notify a provider who does not have the same secure email service. Our service can actually notify a regular account, like a Gmail account or Yahoo account, with notification to go sign in to the secure site. So not all parties have to be on the same system. Not all parties have to be on that same secure email system. You can send it to a non-secure email service that notifies that provider to go back, hey, you've got a message, you need to go into this website and pull that message down. So that's a good feature of ours as well. We are also direct, even though we call it direct secure messaging, we are also direct accredited. Direct is a national accreditation society that really links all of these various services together. So let's go to the next slide and we have a visual that maybe explains it a little bit better. So all secure email services have to meet direct standards. That means that, just like HIPAA, there's certain things that each of these email services have to do. But if they're direct accredited, direct trust accredited, that just allows my system to be able to connect with your system, or my system to be able to connect with Tatiana's system. So when you're looking at meeting the health information exchange requirement for meaningful use, if you're talking to your vendor about your email system, if you're looking for an email system to be able to meet that measure, think in terms of direct standards. Everybody has to meet them, but if they're direct trust accredited, it just allows them to share information with a broader range of providers. So I know we're real close up to our hour. Do we have any questions? Does anybody have their hands raised?
Yes, we have some hands raised. So let me see. Jean Burowette. Looks like she hung up. Okay, she was the only hand raised. We have a few questions in the question box and nothing in the chat.
All right, you want to just read us the questions?
Sure, I'll read the question from Jean. How do they identify the information as being owned by a specific entity?
Oh, I'm assuming that question goes back to the when the federal a federal official comes knocking on the provider's practice and says, hey, we think you had a data breach. We found your patient information. Oftentimes, the data set will include where that data came from or who the provider was. So it may be, for example, if it's a hospital system, it may be an affiliated physician. It may be disclosed that they may just name the name of the clinic or the organization as part of the data set that's being sold.
And then we have several messages from David Schultz that I will put together an email for you. They're very specific. So I'll email them to Kim and Tatiana. So then George Van Herd asked if the calls were being recorded. Yes, this call has been recorded. yes, you can get a copy of the slideshow. Mike Hollingshead says, my understanding of security rule is that opting out of the few security rule elements that aren't mandatory requires a documented analysis to be performed by a qualified statistician demonstrating why it was unreasonable or impossible to comply. Is this correct?
Not the way that question is phrased, because you can't, so none of the elements are not required. That would not be a correct characterization of the components of the security rule. Addressable means that you have more flexibility in how you address them, just for simplicity, but you can't opt out. So there may be situations, for example, where it is not technically feasible for you to do something. And so I'll use encryption as an example. So you may have, or I guess maybe more recent. So we've had a couple of years ago, Microsoft phased out Windows XP. And so a lot of organizations have transitioned over to the new operating system. But there are situations where where software was designed and it will only work on an XP system. And so for a particular practice, or maybe a particular, radiology system or something, a particular software system, that practice may not be able to transition out of the Windows XP system because of the need for that software. Maybe the redevelopment of that software is cost prohibitive, like $500,000 to redesign the system to make it compatible with a newer operating system. And so in that case, it's not that you can opt out of compliance and just continue to use Windows XP systems for your entire environment. No, that means that you need to segregate that system, cut it off from access to the internet, and put in a whole bunch of controls to make sure that you're not creating an inadvertent risk for the rest of your organization and for your patients, because Windows XP is no longer supported. So you really do, I don't know that you have to hire a technical expert to do an assessment to say why it's not possible, but you do need to have, a pretty strong argument in some cases for why you couldn't do something. Any other questions?
Well, there are quite a few questions and comments throughout the meeting that I will be happy to send to Kim and Tatiana, and they will be sure to follow up because your information is also stored with your questions. Kim or Tatiana, did you have any closing statements?
No, I appreciate that. We will follow up on the questions, and I do love to say thank you to Tatiana. Tatiana is in private practice and is just assisting the agency with this particular webinar. Like I said, she has spoke on our behalf in other avenues and was always a very well-liked speaker, so thank you for taking time today. We also, from the agency standpoint, we have rules and security requirements, especially for our Medicaid providers, so, be sure that you're familiar with those as well. We'll continue National HIT Week tomorrow with kind of a look back on the EHR incentive program, kind of as well as where it's going in the future. And then we'll follow up on Friday with the future of health IT, which is going to be a really exciting panel, just looking at where all of this is going, how far we've come, but more importantly, where are we going with a lot of this. So thank you again, Tatiana. Do you have anything you'd like to say in closing?
Thank you very much for having me. I just want to mention one thing about the Equifax breach, which is unfortunately very serious. For those of you who have not frozen your credit yet, please, please, please do that to minimize the risk of identity theft. As you saw from Kim's statistics earlier, healthcare information is very, very valuable, and that stands apart from what we're seeing now from the Equifax side. Unfortunately, freezing your credit will do nothing to actually protect your healthcare file because those two things don't intersect. So to minimize the risk that someone is misusing your healthcare information, please make sure that you're reading your EOB statements from your insurance company. And make sure that if there's something on there that you don't understand, that you're flagging that right away to try and find those issues before they get worse. Again, thank you all very much for joining the call and for allowing me to share this information with you.
Well, thanks, everyone, and we'll get these questions followed up on. Have a great rest of your day.
Bye-bye.